now let's discuss about tracheostomy. As we all know, tracheostomy is nothing but creating an opening at the trachea region. It is actually done to to restore the airway, to remove that blockage of the airway. If there is any airway blockage on it, to remove that blockage of the airway, we actually do this tracheostomy. Tracheostomy is actually a Greek word where stoma is to create an opening. Stoma is mouth, right? We create an opening in the trachea. That is nothing but tracheostomy. Before going into tracheostomy, I'll just deal with a small thing of anatomy. Normally, trachea is present in the midline of the neck. The extensions are superior thyroid cartilage at C6 to tracheal bifurcation at the level of sternal angle, that is your T5. Normally, the C-shaped cartilaginous rings are present in the trachea, usually like this. They are about 16 to 20 in number. The length is 10 to 12 centimeters and diameter is about 15 to 20 millimeters in the diameter. Now, this is a picture showing the trachea anatomy where we can see tracheal cartilages there, and also we can see the sternal we can see the bifurcation at the level of tracheal bifurcation at the level of sternal angle. So, till then we have this trachea there. And in this process, what we have ocal cords, thyroid cartilage, cricoid cartilage, we have tracheal rings in the process, in that line of your anatomy. Coming to these functions of tracheostomy, what this tracheostomy does. This tracheostomy will actually create an alternate pathway for breathing. It will enhance your alveolar ventilation. It will remove any tracheobronchial secretions that are present, and it will also facilitate an intermittent positive pressure respiration, and it will also be useful to administer anesthesia. It has wide range of indications like upper airway obstruction, for pulmonary ventilation, for pulmonary toilet, for elective procedures also we do this tracheostomy, and other clinical indications include if there is any paralysis of your respiratory muscles, a large tumor is present at the laryngeal region, and if we have any obstruction because of trauma where patient is unconscious and cannot breathe on his own, if his the ventilation process is being hampered, in those cases we actually go ahead with this tracheostomy. Tracheostomy, again we have two types. One is tracheotomy, tracheostomy. Tracheotomy is, it will create an artificial opening in the trachea, whereas tracheostomy, we are actually creating a permanent or semi-permanent opening in the trachea. This is a picture which is actually showing the anatomy of trachea again. In tracheostomy procedure, we again have two different types. One is permanent tracheostomy and temporary tracheostomy. Temporary tracheostomy is usually done to create an artificial ventilation in case of emergencies. Permanent tracheostomy is done in case of patients having any large laryngeal tumors or the paralysis of the breathing muscles. Okay, then we can go ahead with this permanent tracheostomy. And based upon the position of tracheostomy, we again have high tracheostomy, mid and low tracheostomy. And for tracheostomy, we have various tubes. There are, tracheostomy tubes will be present. No, these tubes are of various types. We again have long tube with adjustable flange. We have single or double lumen tubes, cuffed or non-cuffed tubes, tubes with suction wing, or tube with speaking wall provision. Okay, these are the types of tubes, tracheostomy tubes. The first one we have fenestrated tube and non-fenestrated tube. These are again various types of your tracheostomy tubes. How do we actually perform this elective tracheostomy? It is actually performed under GA. Patient is laid supine with elevation over the shoulder. A horizontal incision is given between the cricoid cartilage and suprasternal notch. Okay, between the cricoid cartilage and the suprasternal notch, a horizontal incision is given. Here what happens is we actually divide or retract your thyroid isthmus. After we retract the thyroid isthmus, we will be able to see the trachea. We open the trachea and we insert the tube. Okay, this is elective tracheostomy procedure where a horizontal incision is given between the cricoid cartilage and a suprasternal notch. Other than this, we also do an emergency tracheostomy where within 2 to 4 minutes we will do with a vertical incision. Okay, in case of emergency tracheostomy where vertical incision will be given, within 2 to 4 minutes we finish off this emergency tracheostomy. There is something called cricothyrotomy or mini tracheostomy. Here we give a transverse incision over cricothyroid membrane and this is usually kept only for 3 to 5 days. Okay, in case of minor surgical procedures etc., where we need artificial ventilation for about 3 to 5 days, we go ahead with cricothyrotomy or mini tracheostomy. This is a procedure where we can actually see a slit where median cricothyroid ligament, there we can actually see a procedure in an animated image where